Hello, my name is Tanya McMillan, and I am an Indiana State University BSN nursing student, and I'm here today to talk about women and heart disease, establishing and maintaining a healthy heart. My objectives for this project are to define heart disease, to identify the at-risk populations for heart disease, to identify the signs and symptoms of heart disease, to identify alternatives to reduce the risk of heart disease, and to identify means of communication between the client, nursing peers, the interdisciplinary teams, and the persons in the community for health promotion. Pre-test questions. Number 1. How many women die from heart disease each year? 2. Name preventive measures which could reduce the risk of getting heart disease. 3. Is smoking or tobacco use a risk factor in heart disease? 4. Does too much alcohol use increase, decrease, or has no effect in heart disease? 5. Is heart disease typically a man's disease? 6. When should you seek help after noticing when signs or symptoms begin? 7. What type of diet should you consume to lower the risk of heart disease? 8. Does race or ethnicity have a significant factor in heart disease in women? 9. At what age are women more at risk for heart disease? 10. Name some of the signs or symptoms of heart disease. Okay, next, what is heart disease? The term heart disease refers to several types of heart conditions. The most common type of heart disease in the United States is coronary artery disease, or CAD, which affects the blood flow to the heart. Decreased blood flow can cause a heart attack. Heart disease is the leading cause of death for women in the United States, killing about 299,578 women in 2017, or about 1 in every 5 female deaths. Heart disease is the leading cause of death for African American and white women in the United States. Among American Indian and Alaska Native women, heart disease and cancer cause roughly the same number of deaths each year. For Hispanic and Asian or Pacific Islander women, heart disease is second only to cancer as a cause of death. Among women, 90% have one or more risk factors for heart disease at some point in their lives, according to the American Heart Association statistics. Yet, 80% of cardiovascular diseases are preventable. Heart disease, risk factors for women. There are several risk factors that affect women in heart disease. There is your blood pressure, high blood cholesterol, an unhealthy lifestyle, being overweight or obese, diabetes or being pre-diabetes, smoking or tobacco use, excessive alcohol use, being physically inactive, having an unhealthy diet, a family history of heart disease, having a history of preeclampsia during pregnancy, or your age, women being 55 years or older. Heart disease, signs and symptoms. The common signs and symptoms for heart disease in women are usually heavy pressure on the chest, like there's a ton of weight on you. Sharp upper body pain in the neck, back, and jaw. Severe shortness of breath. Cold sweats, not hot flashes like from menopause. Unusual or unexplained fatigue or tiredness. Unfamiliar dizziness or lightheadedness. Unexplained nausea, feeling like I'm sick to my stomach, or vomiting. If you seek help quickly, treatment can save your life and prevent permanent damage to your heart muscle. Treatment works best if given within 1 hour of when symptoms begin. If you have any of these symptoms, please call 911 right away. Heart disease, reducing the risk. Always know your blood pressure. Having uncontrolled blood pressure can lead to heart disease. High blood pressure has no symptoms, so it's important to have your blood pressure checked regularly. Talk to your doctor or healthcare team about whether you should be tested for diabetes. Having uncontrolled diabetes raises your risk of heart disease. Quit smoking. If you don't smoke, don't start. Discuss checking your blood cholesterol and triglyceride levels with your doctor. Make healthy food choices. Being overweight or obese raises your risk of heart disease. Increase the amount of intensity of your physical activity to burn more calories. Aim for at least 150 minutes of moderate physical activity or 75 minutes of vigorous physical activity or an equal combination of both each week. Limit alcohol use to 1 drink per day. Manage stress levels by finding healthy coping skills. Heart disease, communicating between the client, healthcare personnel, and the community. Keeping the lines of communication open with your healthcare providers are vital. Always schedule annual checkups and ask for diabetes, cholesterol, and if needed, cardiology testing like ECGs or even echocardiograms. If overweight issues are a concern, enlist the guidance of a nutritionist for weight management. Request help from social workers in the community if assistance is needed in the home. Counseling should also be recommended if diagnosed with heart disease to aid with coping skills. So, our post-test questions and answers. Number 1, how many women die from heart disease each year? According to the 2017 statistic, about A, 150,000, B, about 225,000, or C, about 300,000. The answer is C. Name preventive measures which could reduce the risk of getting heart disease. Select all that apply. A, eating foods with saturated fats. B, exercising. C, regular checkups. D, drinking lots of wine. Or E, minimizing stress. The answers are B, C, and E. Number 3, is smoking or tobacco use a risk factor in heart disease? A, true. B, false. The answer is A. 4, does too much alcohol use increase, decrease, or has no effect in heart disease? The answer is, your choices are A, increase, B, decrease, or C, has no effect. The answer is A. 5, is heart disease typically known as a man's disease? The choices are A, yes, or B, no. The answer is A. 6, when should you seek help after noticing when signs or symptoms begin? A, after 24 hours, B, after you lie down for 30 minutes, or C, within 1 hour. The answer is C. 7, what type of diet should you consume to lower the risk of heart disease? A, the keto diet, B, heart healthy diet, or C, the Atkins diet. The answer is B. 8, does race or ethnicity have a significant factor in heart disease in women? A, yes, or B, no. The answer is B. 9, at what age are women more at risk for heart disease? A, 55, B, 45, or C, 50. The answer is A. 10, name some of the signs or symptoms of heart disease. Select all that apply. A, angina, dull and heavy or sharp chest pain or discomfort. B, severe headache. C, pain in the neck, jaw, or throat. D, light sensitivity in the eyes. E, pain in the upper abdomen or back. The answers are A, C, and E. The reference materials can be found at www.heart.org or cdc.org for further information pertaining to women and heart disease.